Okay, for this video, I will be showing how I would do a musculoskeletal assessment on a resident. However, I don't have anyone to practice on physically, and my resident has been a pillow, which has been helpful for other assessments, but can't really help in this one when I'm assessing the range of motion of joints or any pain in joints and movement, as pillows can't move or don't have joints. So I will just be talking and leading you through how I would conduct a typical musculoskeletal assessment on a patient, what I'd be looking for, and what questions I'd typically ask. So when I walked into the room, I would perform my hand hygiene, use my hand sanitizer, I would introduce myself. I would say, "Hi, my name is Juliana. Today I'll be your student nurse. Today I was asked to come in and do a musculoskeletal assessment on you." So what that means is I'm going to ask you a couple questions about your history and your ability to move, about your mobility, and move any joints and assess the pain levels there. Is that okay with you? And if it was okay, then I would proceed. I would provide the patient with privacy if they were in an area where it wasn't so private. I would start by asking them about their medical history. I would ask them if there's any painful movements in any joints or muscles anywhere, and if they know what caused it or where it came from, if they know, if there's a specific reason how they acquired this pain. And I would also ask if they've had any previous injuries, surgeries, any issues with any of the joints and muscles in their body. So from there, I would inspect all of the joints. I would inspect the size, their contour. I would inspect the skin overlying the joint. I would palpate the joint area. I would feel for any bony articulations. I would feel for any swelling, any pain, any tenderness. I would also conduct a range of motion assessment. So I would assess their ability to move their shoulders. I would assess their ability to move their elbows, their wrists, their legs, their hips, their knees, their ankles, and I would assess whether it was an active range of motion, whether they were putting in the effort to move the joints, or whether it was a passive range of motion, whether I was helping to move the joints. I would also assess their strength, their ability to move and use their strength. I would risk for falls, which I would ask the resident if they've had any issues of falling, whether immediately or within the last 3 months. I would also ask if they have an ambulatory aid, such as a walker, any furniture they can hold onto, any crutches. I would see if they were attached to an IV, because that could lead to trips or falls. I would ask their ability in their gait to be able to walk and get up and move around. And I would also assess their mental status, if they can determine their orientation and what's surrounding them. That's more of the next assessment, the mental health assessment. But I would assess all of those items and I would add up the scores, and that would help me determine whether they were at a high risk to fall or not.